Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about how to do a pain assessment on a patient with dementia. A couple of myths I want to bring up before we start this. The first of which is elderly people are supposed to be in pain. It's normal to be in pain as you get older. And no, that's not true. So pain is always seen as an abnormal and it doesn't matter what age you are. The second one, specifically related to what we're going to talk about here, is that people with dementia don't experience pain. And that's simply not true. Yes, they do. Or the idea that, well, they experience pain, but they don't remember that they're in pain, so it's okay, we don't have to do anything about it. No. If they're experiencing pain, right, they have the right to pain control just like anybody else. So that's what this scale is about. This is called the PAINAD, so a pain scale for people who have advanced dementia. So they may not be able to verbalize that they're in pain, or if we gave them like a faces chart, they may not be able to accurately point to the faces, things like that. So this scale is specifically for those people. This is what's considered an observable scale. So we kind of figure out what's going on with them by watching them. So you want to watch them for a solid 5 minutes to help determine if they're in pain. We're going to be assessing 5 categories of behavior and scoring them either 0, 1, or 2 points. So 0 is best, right? 0 is no pain, pain-free. A score of 1 to 3 is mild. 4 to 6 is moderate. And 7 to 10 is severe pain. So starting with the first category, we're going to be assessing their breathing. How are they breathing? So if they're breathing normally, it's not labored, it's regular, a good rise and fall of the chest, everything looks good, it's a 0. A 1 is if they have occasionally labored breathing or short periods of hyperventilation. And then a 2, if they have noisy, labored breathing, longer periods of hyperventilation, or Shane-Stokes breathing. The second behavior we're going to check for, negative vocalization. So a 0 is none, they're not doing that. A 1 is the occasional moan, moans and groans, kind of just kind of noises. Or negative low-level speech. So what is meant by that? Think about patients who are mumbly or muttery, you can't maybe make out what they're saying, or they're speaking in a really low voice and maybe they're saying curse words and things like that. They're complaining, they're whining, okay? That kind of thing. That is an example of negative low-level speech. And then 2, actively crying, loud moaning, or troubled calling out. Troubled calling out is like repeating yourself over and over again. That's a sign that somebody's in distress when they keep repeating themselves. Facial expression, this one's probably the easiest one, right? So are they smiling? Do they look happy? If they are, that's a 0. Are they frowning? Do they look sad or do they look frightened? That's 1. And then for 2, grimacing. They look like they're in pain. They're making a pain face. Okay, that's a 2. Assessing their body language, do they look relaxed? Do they look like they're comfortable? 1, do they look more tense than usual? Are they pacing, if they're capable of that? Are they pacing? Or fidgeting? Are they just messing with stuff? They can't sit still, right? They look uncomfortable. That's a 1. And then 2, tightly clenched fists, okay? Maybe they're shaking them at you, or maybe they're just, sitting in their chair with their fists clenched, right? That's a sign of pain. Pulling their knees up if they're capable, so doing things like this, that might be a sign of pain. Pulling or pushing away. So if you try to comfort them, maybe do some therapeutic touch, put your hand on their back. Are you okay, Mrs. Johnson? And they push you away, or they don't want to deal with you. That goes for category 2. Or striking out. That is physical abuse of any kind. So if they try to hit you or smack you or anything like that, okay, that's a 2 on this pain scale. And then the final thing is consolability. can you console them? If they're not in pain, then you don't need to console them, right? So that's what 0 is for. No need to console. A 1 is if you can console them, you can use distraction or reassure them by just speaking to them, talking to them, or using therapeutic touch, okay? So you'll get a 1 for consolability for that. And then finally, number 2, unable to console. So no matter what you do, they're not having it, they're not happy. Maybe you're trying to console them and they're doing these things like striking out. Okay, so no matter what you do, unable to console for number 2. Certain assessments can be more challenging in the patient with advanced dementia. So hopefully, now that we've gone over it, you can use this tool in doing a pain assessment on this patient population, because they, like everybody else, deserve pain control, right? They deserve to be helped when they're in pain. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.